And over the last few weeks, we've seen so many institutions and individuals contributing their quota to supporting frontline health workers with various interventions. And this morning, we'll be speaking to one of such people. Now, he has a project dubbed Green Gratitude. And in actual fact, he's provided packed meals to frontline doctors and nurses in Building 5 of the University of Ghana Medical School. And his project was birthed from his personal experience as a COVID-19 patient. So Russell Bamfo joins us via Zoom this morning. Good morning, Russell. Russell, can you hear me?
Yes, I can.
All right. Good morning.
Good morning.
How are you
Good
doing?
morning. I'm keeping well by the grace of God.
Great job supporting health workers. But we're curious as to what the story really is, because we got the indication that you started this as a result of your personal experience with the COVID-19 pandemic. Tell us more.
Yes, it is. Somewhere early June, or just before June, latter part of May, I fell ill, and by the day it was getting worse. So I had to go and see my doctor. Subsequently, after she had tested for malaria, typhoid, and to see whether there were any infection, she saw none.
Okay.
So we agreed that I should follow up with a COVID test, which I did. But prior to the test results coming out, I started feeling terrible by the day. I mean,
why?
It got to a point because I was getting weaker by the day.
What were the symptoms, if you don't mind sharing?
I wasn't in pain, but I just felt that I was weak. I couldn't walk for a longer period. I mean, I could barely take 10 steps. After 10 steps, I was exhausted. And so on and so forth. I mean, running temperature off and on. So
did you lose your sense of taste, sense of smell? Were you coughing?
I did not lose my sense of taste and sense of smell, but I lost appetite totally. I would barely eat for the 10 days or so that I was at home. So I ended up at 37 one morning.
Yeah.
By the time I got to 37, I was actually losing breath.
Wow.
I was put on straight to the X-ray. I did an X-ray, and we noticed I had pneumonia.
Okay.
So immediately I was admitted at 37. But then when the doctor saw the chest infection in the lungs, they were very suspicious that it was COVID.
Okay.
God being so, results came the following day, and I tested
positive.
Positive.
Okay. So was that when you were transferred to the UGMC, or did you stay at 37 for a while?
So initially I was transferred. Immediately I was transferred to the Airwork Isolation Center, which is at the Airwork Stadium.
Okay.
Yes. When I got there, I was put on oxygen again. Somewhere along the line, the bed on which I was lying ran out of oxygen.
Okay.
So I needed another bed, or they needed to bring me oxygen. That took a while. I mean,
when you say a while, how long?
A couple of hours.
Wow.
Yes. And at this time, I didn't have oxygen. Finally, oxygen. I was moved to another bed, and yes, oxygen was on that bed.
Okay.
On the other bed I was taken to, whilst I was sleeping at dawn, around about 2 a.m. or so, my oxygen also got finished.
Wow.
So yes, it was by the grace of God that I managed to survive till morning.
Mm-hmm.
For me, I believe that all the time that maybe something could have happened to him, but I think
yeah,
God had intervened. That's the only interpretation I could put to that. Yes. So I think as a result of that, we we pushed that I go to UGMC because we felt that my situation was getting worse.
Okay.
Yes. So that's how I ended up at UGMC on a Wednesday, I believe.
How long did you stay at UGMC for?
Close to 3 weeks, I guess.
3 weeks?
Yes. But then when I got to UGMC, I was taken to the ICU initially.
Okay.
And I think a day or so, I was stepped down to the ward.
Okay.
So had oxygen with me for about a day or two. And after which I off the oxygen.
What was the treatment like at UGMC?
I must say, and I must commend them highly. They are very professional. They're doing a very great job, which they need to be supported. And I guess frontline workers generally are a great job. They are putting their life at risk for us, you and I, and that brings me to why I had also decided that if God being so good, I have survived, and I've seen what our frontline workers are doing to help you and I.
Yeah.
Just only fair that we also try to do our bit.
Yeah. But is it more about gratitude for the frontline health workers for how they took good care of you, or is it more about the gaps that you identified as you moved from one hospital to the other? Because you're saying that your oxygen got exhausted twice in one of the centers.
Yeah, good question. I think it's both. I mean, first of all, I think that I came to a realization whilst I was at the hospital that, look, one can do more to help or support what government is doing. My view is that government cannot do it all. Okay, and if you look at the rate at which the cases are growing, we could get to the point that the whole system will be overwhelmed.
Yeah.
Okay. So I have the responsibility, just as you do, to also see what we can do. Okay. So first of all, yes, it is born out of the appreciation that I feel I owe these nurses and doctors, and two, it's also the realization that we as people can also do something small to support whatever efforts government is doing, and I think that is why
you have green gratitude. Tell me more about what exactly it is you're doing and why green gratitude.
So, well, green. The word green, I took it just because you realize that on a daily basis and generally nurses wear green.
Okay.
And gratitude, of course, for what it means.
Oh, I see. I thought you took it from the fact that green means life and productivity. So maybe that's why. Anyway, carry on.
So essentially, what we seek to do is to coordinate fundraising initiatives and manage interventions and programs, okay, for frontline workers, I think nurses and doctors in general.
Yeah.
And we also want to do this by partnering the unions, corporate Ghana, government and other stakeholders to basically institutionalize programs and interventions that seek to the welfare of these frontline workers. Okay. I feel that in any organization, you may have a few bad nuts.
Yeah.
But greater majority of the people out there are very good people who are dedicated to what they are doing. But they do also have constraints, okay, serious constraints. And you can find nurses and doctors who are working 72 hours as a result of this COVID pandemic. Okay. What can we do?
Yeah.
What can you, as citizens, just to show appreciation to them and tell them, look, know you are doing a good job. We appreciate what you are doing. And we just say thank you to boost your morale to do more.
Russell, okay. Yeah, but it looks as if the people who have the voice and they have the ability to support, most of them wait till they experience the virus before they actually come out, tell their story and say, as a result, I'm helping and I'm doing this. You have experienced it. What do you have to say to the institutions, to the individuals who have not lent a helping hand yet and are probably waiting, maybe to experience it, God forbid, before they decide that because of my experience, I'm going to help frontline health workers or support in taking care of people who are infected?
So yes, I remember yesterday I was interviewed by Kwame Sefakan on Peace FM, and I made a statement that this is a disease that I will not even wish for my worst end. Never. It is so terrible. So for the people out there, what I want to say is that if you can help, let's join hands and support, because COVID has no respect of persons. It doesn't matter whether you're a president, you're a prime minister, you're the richest business executive in the country or what. You can be exposed to it. And the evidence is there to tell those who have in the past or in recent past have been affected by the COVID-19 disease. So it is essential and important that each and everyone, all of us, would come together and show support and contribute a little to whatever government is also doing to make find for us to be able to manage the situation. Because if the system gets overwhelmed, like I said, we will all crash.
Absolutely.
Because the hospital beds are getting full. People are getting affected, and we cannot get beds for them. The more critical cases we may get, the more dangerous our situation as a country will become. So the time to act and support is now.
Yeah.
Would also be one of the platforms to be used to implement some of these interventions. And I can only call on the public to support us.
Absolutely. And quick one before I let you go. I'm sure that even before this, you probably have had your stint with some health facilities. There's been complaints over and over about the fact that our health sector is underdeveloped, under-equipped. We don't have all the right tools, and we barely have enough hospitals. Now, after you've experienced this, how do you feel about the fact that these same health workers constantly are putting out statements, telling governments we don't have PPEs, we don't have this, we don't have that? We require you to put your foot down and make sure that we are also protected. I know that you have launched Green Gratitude, which is fantastic. But how do you honestly feel about the fact that these health workers who are supposed to be protecting us, unfortunately, are complaining about lack of PPEs and all that?
I think this question is a bit political.
It's not political, nothing at all. I mean, as a citizen, there's nothing political about this. How do you genuinely feel about some of the challenges that they face?
My view is that, and I still stand by my, I feel that we all owe it a responsibility to see what we can do. There have been several organizations, and I'm a Rotarian as well, and I know, for instance, Rotary has also contributed in terms of PPE to health workers. But, you know, the enormity of the tax is so is so serious that one person or government alone cannot do it. You see, so yes, as much as if it is PPEs that a private individual can provide, let's do that. If it's food that we can supply, if it's allowances or fuel coupons that we can give to nurses and doctors, let's do that to make Ghana a better place. We would all be happy if we come back to the old normal, but it's not going to be that easy if we are not putting in our efforts. So I think that the issue is about getting on board and not being reliant on, say, government to do everything for us.
Okay. And well, unfortunately, there's no time. But thank you so much for speaking to us, Mr. Russell Bamfo. And we're glad that you survived this virus. And we're looking forward to all the good things you're doing for our frontline health workers. And we do hope that everyone else can jump on board and support one way or the other.